Perfect.
What is that supposed to do? In middle school, I was doing sports and I hit someone that was bigger than me and I went flying and I landed on my tailbone and I heard like a crack almost, which I know probably scares you, but
no, it's just
it kind of felt like I got compressed, and so it went all the way up to my like upper neck and I couldn't walk for a couple days. I was in so much pain. After that, for like 4 years, there was like a lot of lower like tailbone pain, and then kind of went to my middle back because it's probably like messed something up doing this and then doing this and it hurt my neck. And so I just tried to kind of take it easy. I did sports a lot, so the sports like soccer and softball like really irritated it, but I just love the sports, so I would keep doing it.
How long ago? You were a teenager when this
happened? I was probably like 14. 14.
And you're saying a lot of this stems from that accident.
Yeah, and so after that, I noticed that my hips were a little off, and my shoulders over the years, when I stand up, like I'll show you, my shoulders are off.
I know the left side's higher.
Yeah, and so I think because of that, maybe like a lot of my pain now is kind of in my middle back and my upper neck. But it got better over the years because I stopped doing sports. I don't work out. Working out, like running or walking, hurts a lot because this leg feels like it's shorter. But I know it's probably my hips are shifted.
Mm-hmm. You're doing pretty good so far, diagnosing
yourself. I do a lot of research.
Sounds all right. I don't need to teach you anything so far.
And so I think, and also I'm a lash artist, so for
looking down
4 days, 10 hours straight, I don't have any really breaks. I just go like this all day long. I'm so tall, so I'm like arched over the table. I know that I have a couple things off. With
okay, so if you were just to sit like both feet on the ground facing that way, and just kind of take your head backwards, as far back as you can. That's as far back as you can go without it hurting?
It hurts here.
Oh, in the front?
Yeah.
Nothing in the back?
I mean, it hurts back here, but there's a lot of tension here, and then pain right all up through. It's always just right here. And then the pain kind of goes down to my upper shoulders. I'm sure it's all just like lashing.
Well, when you look down, right, your head is just heavier looking down. It just is. It weighs more here. The force generated here and the work that has to be done by these muscles increases for every inch you go forward. Okay, like even I'm looking at you.
I know.
Do you want to pull that shoulder up? Is that just what you want to do?
What do you mean?
Like I saw you adjust yourself and you really pulled
it's just
it up.
When I get comfortable, this is how it sits. And I also do like modeling, so in my modeling pictures I have to try to hold this shoulder up. And it's just this is just how it is and it's comfortable. And I also feel like my hips like might be a little off. I don't know.
You have a left lateral shift.
This way? Like I feel like this one's higher.
Yes.
That's it. I feel like this leg.
Arms by your side for me real quick.
Like this leg just feels so much longer, and something.
Most people's pelvises are shifted to the right, but yours is definitely to the left and risen up.
Mm-hmm.
So now what makes me think is, okay, there's something going on in your mid-back, so go ahead and turn face the wall. Yeah, look at that. Woo!
Yeah, right there, so sore.
But you have the classic right protracted scapula, which 80% of the population has, so hold on a second, something's going on. Yeah, here it is.
Yeah, right there's like a lot of...
Yeah, here we go. On the right there, look at that. That's a rib.
Yeah.
Rib head.
Yeah, I'm really skinny.
No. Yeah, so this whole side of your ribs from
and
it
even
does like stick out.
I think one side of this side goes in more. Like my waists are different. I feel like that's how you can tell something's like off.
It's not just your pelvis though, because let me be the classic 80% because I feel like maybe this is what this accident did to you. Mm-hmm. Most people have a left high shoulder and their pelvis goes out to the right. Something has happened in your mid back right here and it's pulled it over here and you're high.
Okay.
So you're like collapsed on this side. And I'm wondering if you fell and this side of you just got crunched.
That's like
if your left side got
it might have been this side. I don't remember which.
Here, turn this way. Let's see if we can.
It's more here, if anything, like
right on the
below.
COCCYX then. This one's slightly shorter, your right leg.
Yeah.
I mean, very slight though. We're talking a half a centimeter. So now when you go on your stomach, it'll change. And then now we can see it. It's very apparent that this leg is shorter. Something happened. If I press here, does that change it? Does that change your leg length? Yeah, it does quite a bit. So here's L5. Here's the top of S1. You can feel the little ridge of S1. 2, 3, and 4, and that's the end of your sacrum right there.
Okay.
Then here is the coccyx down here, and I can feel it. There's the end of it there. Any pain on the right-hand side of it?
No.
Left-hand side. I do feel a shift, though, to the right. Yeah, definitely.
See, there's like tender.
Yeah, it's definitely, so the little tip of the
I think
coccyx
it's just, way down,
is pointed to the right here. So we're going to hold this down and lift this leg up as high as you can. And down. And this one. Woo, a lot more motion there. Okay, now let's do the lumbar. And this way as high as you can. Good. And this side. Way higher. Okay, the sacrum is not shifted to the right, it is to the left. So the coccyx did go to the right. Okay. Wow. So I believe you that you did something to that little tailpiece there, okay? That little end. Oh, right atlas.
Yeah.
Definitely. Feel that? Here's your atlas. Here's the skull. C1. As I could actually feel the posterior arch of C1. If anything is too sharp or, you just let me know. I'm going to work through these knots. You've got a huge one right there. Oh, well, that's my job.
It's okay. It all feels good. It's just...
I take you right to the edge. I'm like, let's poke it a little bit, and then let go. Come off. Slowly seeing if they want to come out. Let's go into that shoulder you were complaining about. Let's see what's in there.
So weird that there's a knot in my scalp.
I'm going to pick on another one, okay, and more medial. The one we were working on was on the outside. Now let's go get this one in the middle. Check it again. Go down here. See if it wants to come out. This segment right here should be able to rock underneath the skull with no problem. Okay. No, there's one down here. Oh. A bunch of nerves.
The middle area, wherever your thumb is touching, is like also sore. It's crazy, all these little things.
Well, it's my job to really go into detail. Okay, and pick apart everything that I find. Hey, look at that. Smooth.
It feels a lot better.
Yeah. Now I go back just because this is who I am. I check each one again. Okay, 1, 2, 3. A little bit stuck there. 4. All right, 4 and 5 are a little stuck. Okay, so this left side we've got set. Now we gotta go to the right side. Really sore up here? Doing okay?
Yeah, it's fine.
So chin back. Yep, as far back as kind of you can. That'll make it less intense. Yeah. So, ooh, perfect. Ooh, very good. Making sure I've got it all. There's a little one still over here. You got it, you got it. There we go. Perfect. Perfect. Hey. Nice. Now you should be able to go backwards. You want to try it? Let's try it. Come on and sit up for me. No, I haven't fixed all of it. Okay, I didn't do all of it, but just the neck.
That feels looser.
Yeah, look at how
better is up.
This was, I mean, you could look back at where you were, but you were only at 15 degrees here.
Okay.
Now, yeah.
I feel like before I was here.
Yes, but we still have this to fix.
Okay.
But we've gotten half of it. The top half. You understand? Now we gotta get the bottom half. There you go. Very good. Toes towards your chest. Yep, now relax. Got you. Very good.
It just tickles.
Tickles?
Yeah.
Okay, then let's just hold it. How about that?
Yeah.
Not as bad. Okay. You're like, nope, you just went
I'm like
straight
very
to pain.
ticklish.
Okay, then we'll work through it.
No, this is fine.
Yeah, you're okay up here, but then we started about here, and T7 it starts to get a little rough. Yeah, just this lower back. Am I not hurting you? Yeah.
No, it's fine.
I feel like you can handle a lot, actually. Because if you're saying it tickles, then that means I gotta go harder. Are you okay?
I'm fine.
Sorry, I just had to get that one. I didn't warn you. Whoops.
It's okay.
Deep breath then. All the way up. Good. And again. Perfect. Deep breath in. Perfect. Ooh. Yeah, you only had one here that I was worried about. So it went in just fine. Deep breath in. And out. Good. There's that rib. And I'm going to try. There you go. Perfect. Hey, you did it. Back to the roller. I think it just kind of crunched on you when you fell. You must have fallen on this right side and you kind of collapsed the left. Okay. Yeah, you've got some issues here.
So I feel like I'm tightening.
It's okay.
Whenever
I'm not really okay. That's the funny thing about
it doesn't
massage
matter.
versus structural work. Okay, you can relax, and that makes it somewhat more tolerable to yourself for yourself. But I don't really care. I'm going through it. I'm going beyond it. So if you tighten, it doesn't really. It's like go ahead. That's some counter. That's what do they call it? Isometrics. I don't care. Sometimes they tell you to tighten to learn where you are in space. This is all your brain, reprogramming your brain. In fact, if we could change the brain, we probably could change most of this. except for structural, like bony things, but
Yeah.
the brain is in control of all of this. Like we were saying about the embryo at the beginning, it all starts from there, and it's all in the brain. Here I am on the coccyx a little bit. So here's the bottom part of your pelvis right here. Okay, that's where it ends. And you are a lot more prominent over here. Over here, this is called the ischial tuberosity. I am down here on the bottom of it, and this side is just more prominent, this whole side. And I can definitely tell there's a piece in here that shouldn't be here. Should be kind of soft right here, and I feel the bony part of the coccyx there. Okay. Anything going down your leg at all?
Maybe like tingles in my toe, kind of, but not.
When I let off, does it go away?
No, I actually think it's fine. What did you say?
I'll fix them. Get the legs first, and then we'll get the arms. And this elbow comes back. And then you're gonna kind of lean off of the table. So head is back, yes. Bottom leg straight though, you're not gonna fall. There's part of it. And back, head back for me. A little bit there. Yeah, there it goes. Perfect. Now you can go on your side.
That side was good.
Take me a little bit here. Gluteus medius and minimus and part of the TFL here. I'm trying to drag, here's the side of her SI joint right here. Okay, here's her sacrum. I don't feel any cracks or splits. Sometimes when it's a big enough of a crack,
Do you feel it?
I can feel it, yeah, but I don't feel anything. It happened a while ago, so I probably won't.
Oh.
Yep. You ready? There it is. Very good.
What is that supposed to do?
The COCCYX.
You're adjusting it?
Mm-hmm. Now I gotta come to the other side.
What is that thing for the
Huh?
drop piece?
It gives it somewhere to go. It gives the bone somewhere to go. So now I want to push. I was pulling it up. Now I got to pull it. I'm actually going to pull it from the other side. Okay, I'm going to take the left side right on top of it and pull it that way. Very intense move. So did that hurt just me doing that?
I didn't feel anything.
Nothing much? Okay, good. If her little tailbone, okay, is this way, I got to take it from this way and actually push up. So when I was on this side, I was just going up, up.
Mm-hmm.
Now I should be able to go.
Pop it up.
Yes. Well, we'll try. Ooh. Very good. That should be all it needs. Yeah, there you go. Creating a little space in there. Very good. Very good. All right, we'll leave it alone. There we go.
Arms are right.
Head back. Yep. breath in. And on the exhale. Very good. Good, good, good. And again. And popping open those adhesions. And again. I think they're gone. I'm just checking. On this side now. Again. Very good. Ooh. And down. Good, good, good. I know this is intense, so just whatever you can handle. You okay? Some goosebumps there. Oof, all right, all right.
Oh, there you go. Yeah, this doesn't hurt at all.
Yeah,
This is crazy. It looks like the scariest part, but
no, this is my new one, so we're seeing how this does. Well, it's not. I've used it a couple times already. It does pretty good. This one just is like not even a third of the price of the other one. So I'm seeing how my hand holds up using this one compared to my other one, which is like $130. This one's like $50. Still does the job on the patient. You know,
does the same thing.
but it's mostly my hand that we're trying to save. Feel dry?
Yeah, my hand's just dry.
Yeah, maybe we're
Maybe the weather
out.
change
Yeah.
or something.
Look at that.
I feel that little rib.
See, I've tried up here. I can't get anything to come out. Like I can't. Like it's just not coming out. It's just right here, and not even the whole thing of this rib. Just the very top of it.
I feel like the right side would like come out more because it's where like.
Right here maybe.
Oh yeah.
But this was deep. This down here came out from when I was pushing with the green roller. That's what this bruising's from. Now I'm superficial, see, and I don't know how much is going to be on the surface. This was like down in there, next to your spine. So, oh, look at that. It went, this is a paraspinal muscle here. Not too much at the rib.
I think the computer work is what really gets me too. Because then I'm lifting this hand, or no, this one, and it cramps up on my whole shoulder and neck.
You keep your shoulders down. Not too much in the neck. Again, we're gonna go into here. Just look down for me. The only time I'll ever ask you to look down, okay? I'm a big anti-looking down person. Whatever that. What should we call that? Just say no. You're doing okay?
Yeah.
Look down again.
It's all right.
No, you're all right.
You're
You're all right.
upset.
It's okay. It's a little painful. What does that mean? She's just about done. Let me see if there's anything up into the skull, like you were saying before. I don't think there is. It's right here, that lump that I feel. Okay, I'm gonna leave it alone. I'm gonna wipe you down. Lean away from your whole body. No, not much. Done. I'm just kidding. Let's see. Nope, not much. If your ear is free, then it won't make like a big clicking noise. Oh, okay, she's ready. She's ready. Let me get a better grip. All right, lean away. No, I mean I pulled.
I felt that bottom one.
Just it's
like
not
a
bad.
little baby.
It's not like, no, you're good. You're good. Elbows. Ooh. Feel good. Lean away. You said your wrists were hurting.
Yeah,
so
this one always hurts, kind of. Not bad. It's just because I have it in like a dinosaur hand position all day.
Oh, lean away, lean away. Yeah, I can feel it. It's kind of doesn't want to go.
It always feels like it's
that
popped
way.
out or something.
Well, look at that. Yeah, it is like more prominent.
Yeah.
There. Lean away from me. There it is.
Oh, you got it. It popped.
Get it. I don't pull too hard on you guys. Like, if it doesn't want to go, it doesn't want to go. Do the shoulders. Push your elbow into mine. Back here.
Okay. Ooh. There we go.
I don't know how to explain it until you do it. You know, there's no other way around it. Then push your elbow back. Okay.
Sorry.
It's okay. Now you know what's coming, so you're more hesitant. It's okay. It's okay. Good.
Oh, there we go.
Because it's really you have to do
Yeah.
it. It's a weird one. For me, left shoulder still high.
Really? It feels like this one's less pulled down though.
Okay.
I mean, I'm sure it's gonna take multiple sessions in order to like get it.
Well, I haven't even stretched you yet. Like, I haven't stretched you.
But I feel like my hips feel better. Maybe it's just psychological. I don't know, but I
Oh,
feel
no,
like
no,
it
no.
feels better.
Well, that's all that
It feels
matters.
more even, kind of.
Okay. Let me see if I can correct it this way. Head back a little bit. I want to take you. It's actually not your shoulder. It's here.
It is.
Yeah. Yeah, it just wants to go bam.
I know. It's so
Okay.
annoying.
So now let's do another exercise. Okay, we're done for now, Linnea.